Welcome to the Mount Zion Baptist Church Mental Health Ministry presentation or event that is being held in honor of Minority Mental Health Awareness Month. We are going to have a candid conversation about the sensitive topic of mental health and wellness in the Black community. I'd like to take this opportunity to welcome our guests that are here today, our panel members, as well as our audience participants, and I would like to welcome the social media community. If I could ask each and every one of you to like and share this presentation, that would be great. We do want to spread the awareness surrounding mental health in our Black community, and not just our Black community, but minority communities in general. I'll take a quick moment before we get started just to introduce our panel members. We have Ms. Taisha Howard, and she is an LPC here in the Albany, Georgia area. And next to her, we have Dr. Jayla Burnett Gentry, and she's a psychiatrist here in the Albany area. And right here next to me, we have Ms. Tanza Sutton, and she too is a LPC here in the Albany area. And without further ado, I would like to go ahead and kick off with our video that will be kind of the icebreaker or the lead into our discussion this morning.
Hello.
Ooh.
My name is Layla.
My name is Connie.
My name is Courtney. This is my beautiful mother and my beautiful daughter. And I am a mother. I am a woman learning how to heal. Yeah. And I'm glad to be here.
This is 3 generations, right?
If I wait for my trauma to be completely gone, I'll never live.
So for you, Mom, I wonder, how did you view helping us talk about our emotions? And I'm really asking just because I may not remember certain things, but what was that like when we were growing up?
It wasn't forthright in the sense of, I need to do this. So it wasn't this just, hey, we need to gather around and sit and just talk. I probably saw you more as a challenge, because it's for you to question something, and you didn't necessarily you did. You just had questions about things, which is necessary, but I saw that as, she's not cooperating with whatever I'm struggling with, so therefore I need to handle it this way. Part of me now, I regret it. But then I'm learning, like, it's not only okay, it's necessary.
It's interesting. You made the comment of saying, if we question things, it was like disrespect, and not with you, but just in general in the Black community. It's such a toxic way of thinking. It's been so unhealthy and creates these unhealthy dynamics in families, to the point that you have a bunch of adults living as children on the inside because we haven't been able to have those kinds of conversations. But you don't realize until you're a parent how much the stuff you've gone through immediately comes out. And then you realize, wait a minute, I'm doing the exact same thing that my mom did to me that I hated.
That's right.
And there's a level of humility that has to come in when we talk about mental health and emotions, because we're not going to understand everybody and why they feel the way that they do. And that's the hardest thing that I think that's been taken from the Black community, is our right to feel.
It was really helpful when we talked earlier about mental health. I've really been thinking about it, and it's one thing to talk about it and intentionally, but then when life shows up and then it hits you about what you said, you don't want it to be like just for the purpose of a teachable moment, and not to put it into practice. Raised so regimented, everything was, and yet I didn't necessarily like that, but it's interesting how I didn't like it, but it became a part of who I was, but yet who I didn't want to be. It's deep.
Because I think in your case, right, you figure that stuff out later down the line.
Yeah.
So
That's good.
I mean, it's harder for seasoned individuals to kind of separate the two. Me, I have an opportunity to kind of do it a little bit earlier, and then we have this one, who has the opportunity to not even have it as a part of a problem. 3, 2, 1. Kids are the most resilient when it comes to trauma. And they find ways to be happy, even in the midst, because she's, this pandemic has been a lot.
Have you ever looked at a picture and remembered exactly where you were at that time emotionally? Thinking about mental health and how happy we were in these pictures, but I remember the day before and when I got there, I was not in that space. I was not happy, struggling with my emotions and feeling stifled with sharing how I felt. And I share this because I think we as Black people and people in general have to remember mental health and emotional healing is a journey. And it's not all going to be okay all the time. I feel like that was one moment where I felt like, just let it go for now. It's okay. You can handle it. You'll deal with it. It matters. Have fun. And I was able to let go of it and just have fun. And these smiles were authentic. Yeah. They remind me that healing is a journey. Yeah. And there are great moments along the way. Doesn't mean we didn't all have our own stuff we're still thinking about, but I'm grateful we took these. I'm grateful we have them.
You all learned on your individual journeys. It wasn't nourished with your parents, but you all learned the importance of that, and I'm so glad for it. I'm glad. I would have liked to have been able to, and that's the reason why I'll pour it on her now.
Yeah, but the past, I mean, it is what it is, but
I know.
Knowing that you can still move forward, you can still progress. If I could give any advice to Black families, be kind to yourself. Whether you're a parent, whether you're a child, be intentional with explaining how you feel instead of blaming. The only way we're taught how to express our emotions is when we're angry, and so it's automatically coming at somebody else, even though they may be the reason. It never helps you to get to the source of what's going on inside. And the more you ask, you really start to understand what's going on underneath the surface. It's hard to start a healing process if you really don't understand how you feel. And that's where the arguments come, which is why I think Black families, we can't ever get to the healing portion because we're so busy fighting each other instead of having empathy for each other and recognizing that we're all hurting because of all different reasons.
Each generation is being taught different things. So I also see the importance for families to embrace and acknowledge and even celebrate in the moment whatever somebody else is feeling. Encourage them to talk and just embrace whatever they feel and don't take it personally because it's never meant to be personal.
You don't have to know it all. You don't have to, it's just healing to be able to have those kinds of conversations and acknowledging it. Half the problems would stop if we just acknowledge what happened as real. That's why I said be kind to yourself, because you're going to mess up and you're going to have moments, and because restraint, especially when you're triggered, is hard. But I think if we're kind to ourselves, we don't give up, no matter how hard it gets. Take a break. We don't give up. We as Black families, we as a Black community, we start getting the healing that our ancestors didn't get. We're doing it for them. We're doing it for us. And now that we have the freedom to do so, ridding ourselves of the generational curses and the cultural curses that have been placed on us that we've inhabited as this is who we are. No, we can get rid of that. So that would be my prayer and words of love to Black families, because this is some real stuff.
The video that we just watched is a video that was prepared by NAMI, the NAMI organization, which is the National Alliance on Mental Illness. And the title of the video is Black Families and Mental Wellness, Smiling on Our Journey. So I will start with our first audience participant, and that's Mr. Isaiah Wright. If you would come to the microphone, I'll ask you the first question to get our conversation started here this morning. What does mental health and emotional wellness mean to you?
Mental health and emotional wellness means a lot to me because, especially in my age group, in Gen Z, walking around school, you can really see how mental health affects how we interact with each other, how our grades are, how we interact with our parents, and talking to friends personally. I know different things of mental health and how bad it really can be, and that no one really has anyone to talk to. So it's a shunned stigma around mental health, yet that's one of the main important things that needs to be talked about because your brain is just like any other body part. So it needs wellness and it needs to be treated, or else you can't do nothing without your brain. So mental health means a lot to me because if you don't have well mental health, you might not even be here.
Absolutely, thank you for that. And that is so true. We have to start reaching the young generation early so that they can learn coping skills and learn how to navigate through life because they will be faced with challenges and emotional ups and downs. The next question is for Ms. Gestoria Wright. If you would please come to the microphone. Ms. Wright, the question that we have for you this morning is what have you learned regarding mental health and emotions that you would regard as a generational habit?
As a mother, a daughter, a sister, and a friend, the most valuable thing to be learned about mental health and emotions are we can no longer recognize them, both mental health and emotions, as habits. They both are functions and dysfunctions of a disease of the brain, unlike none other. When we are birthed into this world, God has given each one of us a personality along with genetic traits, which are sometimes referred to as normal and abnormal behaviors. We cannot classify them as habits. Habits are acquired behavior patterns performed regularly until it becomes involuntary. And we all know from our life experiences, those are not habits. It is clearly not a diagnosis or a condition. In my opinion, we as members of society must implement a plan or a system that recognizes and classifies all individuals that may exhibit such traits. This method may help identify and stop the stereotyping of mental health illnesses. I am optimistic that if we put our heads together and work together as a team, we can definitely succeed over time to change the view and stigma of mental health issues. As a whole, we misdiagnose most mental health illnesses such as PTSD, sundowners, behavior traits that may stem from trauma, extensive alcohol or drug use, and autism.
Okay.
I have experienced each one of these issues with a family member of mine. So I have had hands-on experience with each one. So they must be classified in order for us to reach resolution.
Absolutely. I just have a follow-up question for you. I know when we initially spoke, you mentioned being the primary caregiver for your mother.
Yes,
and
ma'am.
working with the elderly. If you could just share a little bit more about mental health with the sundowners, because that's an area of our community I think that we really don't associate mental health with.
It was like, I lost my mom October the 31st, 2020, during the pandemic. I was her primary caregiver. And it was like, I had experience, thank God, for being a CNA for 28 years. So I've experienced senior citizens working in nursing homes and working in the hospitals. It's like each day they wake up somewhere on their timeline in life. And God allowed me to follow my memories to find her, to see where she was that day. With Mama, she mostly thought she was at work. And she worked at Expire for 35 years. And I worked there for 15 years, developmental disability. So she would wander in my room, girl, I'm ready to clock out. You ain't doing the work. On the 4 o'clock, wasted time. I said, Mama, you ain't gave the people their medicine yet. I'm ready to go. They done left me on the clock too long. I said, okay, Mama, go check your paperwork and see if you done gave them the medicine and you have wrote down what they had for dinner and stuff. You're supposed to be doing that. I'm the supervisor. So I feel as if you can find them in that space, it keeps the anxiety down. It keeps the wondering. She was like, I ain't gonna never get out from work. I was like, how you got to work, Mama? I don't know, I was just driving. They told me to come and I just came. So in order to not get frustrated because your mom is not the same, and my sisters, they didn't understand that because they didn't have the experience in nursing homes. Just to see her switch in and out of different modes, it could be painful. Some days it could be frustrating. She would refuse to take her medicine. It took a friend of mine to say, just crush it up. So I'm like, I just broke out in tears. And I didn't apply that. I applied it at work, but I didn't apply it to Mama, and she was spitting the pills out like bullets. So we got a crusher. We started crushing. Mom, you want your cocktail? Yes. You want your snack? Yes. So it was much easier if we just take our time to classify it, and we'll be able to work with it, and it won't be so stressful working and taking care of the grandkids and having to see about Mama.
Right. Thank you so much for that. And the reason why I called your attention to the elderly, to the caregiving of your mom, is because, with the generational habits and what I've seen to be common in the Black community is because we have had a general idea that you stay clear of mental health and emotional disabilities, or you just stay away from it. It's taboo. People say you're crazy, or they're just old or whatever, just don't worry about it. But you need to get connected with their emotional frame of mind and state of mind and meet them where they are.
You keep them there and they feel safe. Mm-hmm. They feel home. They feel secure. They know what, and you have to keep them on a regular pattern. Mm-hmm. Because she used to always say, I don't know what's going on. I don't know what this is. Mm-hmm. And that's when I knew that she would be lost. Right. But I would bring her back. Yeah. I would bring her back. Sometimes she couldn't remember my sister now. And she got real combative towards nighttime. So I got Phoebe. She was at Phoebe. And they used to give her something for anxiety.
Okay. Thank you.
You're welcome.
Thank you. Okay, so moving on to our next audience participant, we have Deacon Johnny Williams, and his question this morning is, how can we proactively start changing generational habits when it comes to mental health, wellness, and emotional wellness?
Right, okay. Well, from my perspective is, from being a caretaker with someone that's dealing with mental health, is that we have to make it more comfortable for the ones that are going through it to be able to have trust in someone to talk about what they're going through. Because most of the time I find that, the one that's dealing with the mental illness don't really trust anyone or everybody with what they're going through. So we as a community got to make it more receptive for them to be able to talk about what they're going through, or the problem that they have, and just find that trust in someone that they can come and talk to about it so they can deal with it. Other than that, they just gonna keep it within themselves, and try to deal with it on their own. it's just no way they could do it by themselves.
Absolutely.
So, to answer your question, we got to be more receptive to mental illness as a whole. You know, it ain't like a monster or something, you know, where just because this person is experiencing mental illness, you look at them a little different. No, you just look at them the same. You know, they people just like we are. Mm-hmm. So what we have to do is just make it easier for them to accept what they, you know, what they're going through.
Right.
Mm-hmm.
Okay, thank you. Thank you so much for that.
Okay.
So I think it's a good time for us to pause and hear from one of our professional panel members today. And the first question, or the first area, I guess, that we can focus on based on what we've heard from our audience up to this point, Ms. Howard, is maybe you can give us some thoughts about what is mental health and emotional wellness.
Okay, I'm going to introduce myself again. I'm Taisha Howard, marriage and family therapist. So I guess we can start by saying that mental health is a range, It can be a range of things, as in first self-care, taking care of yourself, and then also if you do have a mental health diagnosis, getting the help that you need, going to your appointments, taking your medication, just basically taking care of yourself, like the young man said, treating your brain as part of your body and understanding, I have to exercise this muscle, I have to take care of it.
Yes. And what do you know, or what can you help us to understand about the senior citizen community, the sunset? You know, we look at our elderly as being in that phase of their life when it's their sunset, or I don't want to say it like it's some kind of negative thing, because it's a beautiful thing, it's a positive thing. They've gone through their lives and raised their children, their families, worked on jobs for years, and now they're switching roles. Now they have to be cared for by their children, or maybe they're experiencing loneliness because their families don't live nearby. So can you just share something regarding?
Just the main thing, what she was saying is be patient. Be patient and be caring, be understanding. You see someone who has gone from being active, having jobs, having full lives, like she said, to someone who may, you know, just have themselves in the TV, or, hey, my neighbor may come by, bring me food and all of that. So just be patient and reach out to the elderly that you know and who are in your lives, because they need that. And try not to impose also, like the young lady was saying, because you go from being independent to being dependent a little bit, some form. So just be patient and don't impose.
Thank you, Ms. Howard. Thank you very much for those comments. So now we'll move on to our fourth audience participant, and that is Reverend Larry McLean. If you would come to the microphone, I'll read your question. So Reverend McLean, as a Black person, Reverend McLean, what are your thoughts about mental illness or mental health and our faith? How do we, as Christians, as believers of Jesus Christ, our Lord and Savior, how have you experienced the Christian community to respond to mental health? Yes.
Greetings, Moderator Kim. Let me begin by saying that for far too long, mental illness, mental health, and mental well-being has mostly been ignored, pushed aside, and denied outright in the Black faith community. Like so many things in the Black church, we only hear folks say, "Child, just pray about it." Well, everything needs to be bathed in prayer. Yet, sadly, for many of us, that's where we leave it. God told us to support and love one another, and as part of that support from God within, we're to help and to assist those who may be dealing with mental health issues. The Black church can no longer afford to bury its head like an ostrich. and wish this problem would go away. No, we must face it head on. First of all, we must stop blaming the devil. We must dispel the shame, the stigma, and secrecy that so many folks are suffering through. We must educate, empower, and embrace our brothers and sisters who are dealing with this problem. We must no longer be afraid to reach out and help those with care, compassion, and concern. They need us, and we need to provide the help we can. 3 John 2 says, "Beloved, above all, I wish that you prosper and be in good health, even as your souls prosper." Well, good health also means good mental health. And we need to offer therapy, training, and teaching to help our brothers and sisters and those that are in need. Thank you.
Thank you so much. That was excellently said. I truly appreciate you sharing those thoughts because yes, we should be praying about everything, and we should be inviting God into every one of our experiences, but we also have to take some action. And because our mind, our brain is part of our body, most people don't see the science that's associated with it. They just see your mind and your brain as being separate for some reason from your body. But you would go to the doctor, you would definitely pray about your headaches if you were having high blood pressure, hypertension, headaches, or sinus headaches. You would pray, but you would also go and seek professional medical care to get relief from those headaches that are being caused by sinus pressure or a high blood pressure. So why not go and get the professional care that you need to regulate your mind if it's kind of off balance, off course? And there's nothing wrong with that. There should not be any stigma associated with reaching out for medical attention. Thank you so much.
You're welcome.
We'll move on to our next panel, audience panel participant, Dr. Elma Noble. Our question to Dr. Noble is, as a Black person, what are your thoughts about mental illness in the Black community?
From my work experiences, social experiences as a parent, a mother, grandmother, aunt, and all the other various roles, business person in the Albany community, serving people in a number of roles, I do know that mental health issues are prevalent in the Black community. Black people very often have been thought of being very strong. You're survivors, and probably this might be from historically as slaves. You know, we survived all kinds of conditions. And this strongness and being strong and survive has been transmitted through the generations. You don't talk about it. If you feel bad, you'll be okay. You're strong. You can get up. You fall down, but you get up. You're going to be okay. Have a drink of wine, you know, get a good night's sleep, and you'll be okay. But I feel that we're not going to be okay that way. And we have to understand that it's okay not to be okay, and to reassure our friends and family members and recognize when there is a problem. I have had some problems and issues in close friends and family members, and it was very difficult to get them to accept the fact that there is a problem here. There was denial. Oh, he's going to be all right. She's going to be all right. No, they're not going to be all right. This is not something you take an aspirin for and think the headache is going away. Mental health issues are completely different. In the Black community, I believe that anxiety and depression would be the most prevalent. In Black families, there are many single-headed household families, women with 5, 6, and 7 children. So basic survival. How are you going to provide? This can cause anxiety, and it can cause depression. At the end of the day, you realize you can't meet the needs of your children. You can't compete with some of the things that other parents are providing. Your children want the phones. Your children want the polo shirts. Your children want the cars. And you can't provide all this. So this causes a lot of depression and anxiety. And with working parents, you're so busy trying to provide what your children need and to pay the bills and to maintain your style of life. Very often, we overlook the most primary needs of our family. What's going on with our children? Take away the phones and talk. Take away some of the media and talk. You come to the table, everybody's on a phone. There's no talking, and when children and other family members are having problems, sometimes you're just blind and you don't see what's going on. But there are many mental health issues in the black community. And I feel that in the black community, there's a lack of affordability, accessibility, and availability. We don't often know what to do. You know somebody's going through something, where do you go? How do you get the help? Can I afford it? Do you have the insurance? And people, our low-income families, certainly have more issues to deal with. How do I get it? You know, if you have Medicare and Medicaid, more or less, sometimes doctors don't respect these people. You're a handout, you didn't work, you don't have your insurance. So, you know, give you a pill, just you're gonna be okay. They're not given the respect that they need to have. And just in general, we do have lots of problems in the community. In our schools, we're having in-school suspension with kindergartners, children who just don't know how to cope with what's happening to them. And parents and teachers sometimes lack the skills that are needed. So yes, mental health issues are very prevalent in the black community. And no matter what your economic status is or your educational level, anyone is capable of experiencing mental health issues. Okay.
Absolutely. Thank you so much, Dr. Noble. That was very informative, and you hit a lot of key points that are true to communities, minority communities, not just the black community, but minority communities. So thank you for that. And with that, I think it's time again to hear from our panel. We have Ms. Sutton that we will ask to share her thoughts based on the black community's perspective or just about our faith and how we relate our faith to mental health and mental illness and some of the issues that Dr. Noble pointed out. So you're welcome to share your thoughts.
Okay, good morning again. As it relates to faith, a lot of times people who are of the Christian faith feel that he or she should not reach out for mental health assistance. And I was mentioning to someone before when they were talking about the Bible and mental illness, and I said, well, Luke was a physician. How do we know that he wasn't a psychiatrist? I said, mental health has been around a long time. And just as the associate pastor there spoke about wellness, and God wants us to be well, not just of body, but of mind and soul. And as me being a counselor for the many years that I have been, I always tell people that open up and say that they are believers, that the two are integral parts. It is so challenging to have mental health treatment without the spiritual aspect of it. So I feel that if people are open to getting mental health assistance, that as Christians, it is quite okay to do that. Just as well as you would go to the doctor for a headache or for blood pressure, diabetes, or anything else for treatment. We don't normally sit home and say, okay, I'm going to allow God to heal my body. We do believe that he's a healer. We say he's Jehovah Rapha, that he's the God that heals. But we still go to the doctor for healing. So the same happens in the body. The mind needs the same type of healing.
Absolutely. Thank you, Ms. Sutton, for that observation and those comments. So next, we're moving on back, we're going to turn back to our audience participants and ask Yvonne White, Miss Yvonne White, if you would come forward. She's also part of our ministry team, and she does an excellent job keeping us on track. So, Ms. White, could you respond to the following question? How were you able to seek professional medical help or medical services for your mental or emotional illness, if you don't mind sharing?
Good morning, everyone. At first, I was in denial about myself, about my mental illness, and the world around me. I was in and out of hospitals and not taking my medications. One day, while sitting on the front porch of my apartment, something clicked. I wanted to change. So with the help of prayer, studying the Bible, and positive influences in my life, I slowly began to change my thinking. I started going to see my psychiatrist and therapist because I wanted to go. I started taking my medications because I wanted to. I changed my environment and the company that I kept because I wanted to. All of this helped me to get out of the deep pit that I was in. For over 20 years, I have been living with a mental illness. Each day is still a battle, some days better than others. But I wouldn't take nothing from a journey now. I wouldn't change it for nothing. Because one, I now know what's wrong with me. And two, I'm a better person for the experiences I have gone through. I would say to anyone out there who is suffering with a mental illness, please keep pressing forward and don't give up.
Absolutely. Thank you so much, Ms. White, for sharing your story, your journey. And as someone who suffers from depression and anxiety, it was so freeing when I did seek the help and get the therapy that I needed to live a productive life. For years, I suffered in silence because I was afraid if I shared with my job, I would lose my clearance to work. Or, people would view me, since I was a supervisor, a warranted contracting officer, I was always in the forefront. And I thought if people knew that I was suffering with a mental health issue or illness, that I would be judged. But I tell you, it's been wonderful since I have taken that guilt and that shame off of myself. And I've been able to, I'm here. That's all I'll say is I'm here. So with that being said, we're going to move to our next audience participant, and that is Miss Deborah Williams. So thank you for being willing to participate this morning. And the question that I have for you is, as a person on a mental health journey, what has been your experience with regard to trust with the mental health professional medical community? What's been your experience as you've embarked on this journey that you're on?
Oh Lord, it's been 2 years since I started this journey, and I've been through 3 therapists and 2 psychiatrists. None of them understood where I was coming from. None of them wanted to understand. One, I would go into her office, and in 3 minutes, she walking me to the door. Nothing was accomplished. And I did that for 2 years. And I kept telling myself, I can't go on like this. I tell my husband, my children would ask me, why are you in the bed? 3 and 4 days, Mama, I can't get up. I'm begging for some relief. Give me something. And I go to another doctor, he'll just give me pills. I want to talk to you, listen to me. So how can you trust someone that's not willing to listen? They want to be on the computer writing and typing and give you meds. No, that's not what I want. That's not what I need. I want to live a productive life. I was diagnosed with PTSD last year in April. And this year I was diagnosed with bipolar depression. And I go to the Sparrow Center. Very, very good therapist. I love her to death. I trust her. When I walk in the door, I feel safe. I feel like I can share with her. And she share with me. And she teaches me techniques to use when I'm feeling in that dark place. Because I never want to go back there. It's not a good place. So you have to search out your therapist and your psychiatrist for someone that cares, that wants to listen and give you the right medication. If not, you're suffering in silence. What we have been doing for so long is suffering in silence. It's time to come out of that. And I had to admit to myself that I had a problem. And I wanted help for it. I needed help for it. I didn't care who knew me or who they told. It wasn't about that. It was about me getting the help I need to live a productive life. I'm a wife. I'm a mother. I'm a grandmother. PTSD and bipolar depression do not own me. It don't own me. But I'm so glad that right now, I have a therapist that I just feel so comfortable with sharing. And we're doing a lot of breakthroughs that I've never done before or said to any of the other therapists before. I'm sharing with her because she makes me feel that comfortable and safe. And the techniques that she's showing me how to use to help myself, you know. I can't go to a doctor 2 and 3 months down the road. That don't work for me. I need to see someone every week, and I see her. The VA is not, they don't take the time with you that you need, you know. My psychiatrist at St. Tifton with the VA, if I'm in there 12 minutes, that's a long time. She walking you to the door. That's not what I need. Not the medicine. I want you to listen to me as I pour out myself to you. Help me live productive life. You know, trust, feeling safe. My spiritual has never been in question. I love God. God loves me. It was my mental health that I suffer with. Not my spiritual health. And I prayed to him for him to send me. I wanted him to take it off of me. I asked him many times, but he denied that and said, I will be with you while you go through it. Thank you, Jesus. And for leading me to, I was excited about the Mount Zion Mental Health Ministry Awareness. I said, that's where I want to be. That's where I need to be, with people that been through what I've been through, going what I'm going through, that understand, you know. Every day it's not good. I struggle to get up in the morning, struggle, you know, to make it through the day. It's a struggle for me. But I now go to the Sparrow Center and ask y'all she's great. She's great with me, great. And that's what I needed, someone to listen, pour into me, and I pour into you, you know, and that's what we do. And that's what we need, someone that's going to listen, that you trust and you feel safe with, for you to tell those things to. You're not going to tell somebody something that you're in that 3 minutes because you don't trust them. They walking you out the door. So someone that is willing and wanting to listen and wanting to help you. You have to go through some of them until you find the right one. And I have found the right one. And I want to thank you, Kim, for doing this ministry. I love it. I can't wait to do more because I know there are people, women out there that's suffering and don't know how to seek help and just want someone to listen.
Right.
You know, they're afraid, they're embarrassed. I'm not none of that.
Yes.
All of that going out the door.
Yes.
I don't care who knows.
Right.
I don't care who you tell. It's fine.
Right.
God got me.
Right. Yes.
God got me.
Absolutely. Thank you so much
Thank you.
for that. And I know that took courage and a lot to be able to come up to the microphone and share your story. And with that, I will ask Dr. Barnett Gentry, if you would share some final thoughts. You've heard from all of us and heard from the other two panel members. So just the floor is yours to share whatever you feel is on your heart to share.
Thank you, and thank you all again for inviting me here. Thank you for those very personal stories. I just want to highlight both of your very personal stories and the amount of courage and the amount of strength that it shows. And I heard you mention that you are a grandmother, the example that you're setting, okay? Breaking these barriers and the stigma with mental health in our community. So when I was asked to speak, one of the things I was asked to speak about and on was it was a very complex topic. So I have some notes, and it's to help me stay organized, okay? And so first I wanted to talk more about the reluctance of the African American community or the Black community in seeking mental health services. And if we talk about that, we have to go back and talk about slavery. We have to talk about its effects on the African American generation through numerous generations. And then in the medical field, we have to talk about, in the scientific realm, Tuskegee and the syphilis experiment. We have to talk about, more recently, COVID-19 and how it highlighted the disparities that we know existed but are often ignored. It highlighted the systemic and structural racism that we deal with every day and continue to deal with every day. And in the midst of us dealing with COVID-19, a lot of the social injustices. So we can't forget about the George Floyd, we can't forget about Breonna Taylor, we can't forget about Ahmaud Arbery, and that's just to name a few. There are many, many, many more. And so when you think about this and these systems that have been put in place, I mean, it doesn't surprise me that when COVID-19 first arose in 2020, the reluctance that many of us were to get the vaccine. And even question the realness and the validity of COVID-19, the virus. And then another point that we've all highlighted and talked about is how we in the African American community often shy away from seeking help for our mental health and our well-being, and are often taught to just pray about it, and if things still don't go well, then I must not be praying well enough, or I must not be living the right kind of life because I'm dealing with all of it. But it's not true. So how can we, in the African American community, in the Black community, learn to trust? And for me, when I thought about this, it's breaking the stigma, slowly but surely. And we are. I feel like we're moving in the right direction, but I feel like we have a long way to go. And it's normalizing mental health. As Mr. Isaiah said initially, he mentioned that if you don't take care of your mental health, you can't take care of your high blood pressure, your diabetes. And we need to look at mental health as no different than things like hypertension, diabetes, headaches, and that mental health is your physical health and it is your medical health. But often they are seen very differently. And it's increasing awareness, so there's education. It's continuing to talk about it, continuing to have these kind of conversations is definitely pivotal in breaking the stigma and raising awareness and getting more people in seeking help. It's early intervention, starting with the kids, getting them the help. Okay, when you start to notice things, getting them in to see someone, whether it be a therapist, primary care doctor, a psychiatrist, okay? And it's modeling, so it's seeing loved ones, seeing other people that we live with and that are significant figures in our life seeking help, because they will model that behavior. We oftentimes are unaware of the power that we have and the influence that we have over the younger generations. And then me, as my role as a psychiatrist, as a physician, one thing that I am always intentional about is when I have that patient in front of me is just taking the time to listen. So oftentimes I'm getting pressure. Okay, you got to see this patient in 15 minutes. You need to see this patient in 30 minutes. You need to type your notes. Your notes need to be closed in a certain amount of time. But sometimes I say, you know what? I've got this person right here in crisis, and they're dealing with a lot. So I'll stop typing, and I'll just listen. And it's many times, most of my patients say, thank you, because you've made me feel like I've been heard, and I've validated them. I get it. I get it. I get that you're very depressed, you're very anxious because you've dealt with so much trauma, loss, grief. We've all seen a lot of that. Another thing is I'm a huge advocate for my patient, for all my patients. So if I'm feeling that medication, we're not agreeing on medication, I may recommend medication. I'm a huge proponent for shared decision making. So I'm gonna say, you know what, I think we can best treat this PTSD or depression. I feel like you could benefit from medication, but what do you think? What are your thoughts on medication? And if they say, you know what, doc, I really don't want to try medication. One, I wanna understand why, what's the reason, but also, okay, how can I best help you? Okay, is it getting you linked with a social worker to help on some housing assistance, financial assistance? Is it getting you into a therapist or a counselor? And I would still see that patient back even if I'm not prescribing them medication. I have many people, actually quite a few patients, who I don't have on medications, but I'm just checking in on a monthly basis just to see how they're doing. And then explaining the diagnosis and the treatment to the patient. I can't tell you how many times starting in my residency training, starting in my medical school training, I had so many patients, especially patients that look like me, that look like us. And I say, do you know why you're taking this antidepressant or you're taking this antipsychotic? And they said, doc, I have no idea. And I'm like, wow, and how long have you been taking it? Oh, I've been on that for about 20 years. I'm like, oh my goodness. Well, it's time to have a conversation about what this medication is and why you're taking it and explaining their diagnosis to them. And then, again, something I often see way too much is misdiagnosis. Way, way, way too common. Studies have shown that African Americans are more likely to be diagnosed with schizophrenia, okay? Less likely to be diagnosed with things like mood disorders, depression, or bipolar, okay? So when I have that patient that's telling me that they're paranoid in my office, I'm not automatically jumping to a primary psychotic disorder like brief psychotic disorder or schizophrenia. I want to understand, where's this paranoia coming from? Well, doc, my cousin got shot, and I was there. Now I don't feel safe. Well, no wonder you're feeling so paranoid or hypervigilant, but that doesn't mean that you have schizophrenia. That's trauma. That's PTSD, okay? Let's see. And then again, many studies have shown that African American patients usually have a better experience when they see somebody that looks like them. So they see that psychiatrist, see that therapist that looks like them, and it's many times we feel that we're better understood. They know a little bit, they can better understand our struggle, things that we've been dealing with for years, hundreds and hundreds of years, okay? And it brings me to a couple of things that I've seen, a couple of stories that I wanted to highlight. And I imagine that many of you all have experienced this, if not personally, but maybe a family or a friend. But I remember I was in my residency training at Morehouse School of Medicine in Atlanta, and I was on the consult service. So consult service means that they'll say, we want the psychiatrist to see the patient because we're worried that something mental health is going on. Okay, so I get consulted on it was about a 70-year-old African-American male, and they said he's anxious and he's delirious. He's making no sense. And I said, okay. I was like, can you give me a little bit more background on this patient? And they said, well, he's just super anxious. He thinks something bad, the world's coming to an end. And he also says that he knows Outkast and he's worked with Outkast and stuff. And I said, okay. So I'll see him. So I go up there, introduce myself, and start talking to him. I said, hey, it's like they're worried about you. They wanted me to see you and talk to you. They said if you're feeling a little anxious and that you weren't making much sense, you may have been a little confused. And as I talked to him a little bit more, I look up on the TV. And like I said, this was about 2019, just maybe right before the pandemic. So a lot of the social injustice was going on, right? And so on his TV there was a lot of talk around that, and he kept watching it. And he was like, "You see this?" And I said, "Yeah." I said, "I don't try to watch it a lot because it gives me a lot of anxiety." And his mind, he was just so anxious based upon his own experiences. And I imagine him being 70 years old, all the experiences that he has probably endured, right? And I said, you got to turn it off because I want you to take care of yourself, okay? And I said, yeah, you may be a little bit anxious, but it's justified. I get it. And then as I talked some more, he tells me about his personal life. And he said, come here, I want to show you some pictures. He was giving me praise. He was like, you're a psychiatrist? And I said, yeah. He's like, I don't see many psychiatrists that look like you. And I was like, yeah, this is what I want to do. And he calls me over to his bed, and he was like, let me show you some things. And he shows me pictures of him with Outkast. He shows me that he's worked with these individuals before. And in that moment, I found myself getting so emotional because I was like, this guy's not delirious. You all have, and it was a team that was working with him that did not look like him. He looked like us. And it was a team that was working with him that did not look like him. And I called them, and I said, this is in delirium. I said, did y'all try to talk to him and get to know him on a personal level? And no, they didn't. I said, everything that he has told you is true. And I said, Google him and you will find it. And sure enough, we did, okay? And then another story, and then I'll close. Another story, my husband, he sent me I think it was either a TikTok or Instagram video, and it was a nurse, an African-American nurse, and she said that she had heard that a patient of hers that she was seeing, they were getting a psych consult. And so she inquired, said, well, why are y'all getting this psych consult on this patient? They said, well, she keeps just tapping her head like this, and so we want her to see a psychiatrist. And so she said, wait, which patient is it? She said, I'm gonna go talk to her. And she goes to talk to her, come to find out that she had just got a weave put in, and she was just simply just scratching the scalp, something, an experience that many of us are familiar with. So again, it goes to show sometimes just taking that time, the understanding different cultures, shared experiences goes a long way in treating patients.
And in closing, I want to just thank everyone for your participation, and I hope that we can schedule another discussion so we can continue having these conversations. And maybe we don't have to wait until Minority Mental Health Month next year. Maybe there's a way we could reconvene and continue. So in closing, I would like for Ms. Rosie Pearson, Minister Rosie Pearson, to just come up and say a few final words. She's the co-chair for the Mount Zion Mental Health Ministry. She's our ministerial representation for our ministry. And I am so grateful to have her.
Amen. To God be the glory.
Yes.
Let's give everybody a hand.
Yes.
Thank God.
Thank you,
God is
Jesus.
so real. I thank him for the vision that he gave our pastor for this ministry. And this is just the beginning.
Yes.
Mental health is something that is really dear to my heart. And along with that comes a lot of other stuff. It comes community, it comes family, it comes substance abuse, so much. So we have a long way ahead of us, and we pray that this ministry will help our community. This is just a start. We want to educate. We want to start off by making people aware.
Yes.
And that the stigma is there, and to make people, like a lot of us was talking, to start to trust us. That's one of the main things in our culture, that trust.
Right.
So we just want this to be the beginning of a lot, letting everybody know the signs, the symptoms, how to cope, you know, and most of all, you know, the good thing about it is having mental health issue, diagnosis myself. God is the center. You know, once we get on that road, we know that the bottom line is, as long as you know that you're loved and you're somebody, and God give us all this light. He said we are the light of the world. So this is what we're doing here. We are being a light. We're the salt of the earth. We're giving this to so many people who are in darkness, you know, who are weeping. But we're going to let them know weeping just endured for a night, but joy comes in the morning.
Amen.
So thank you all for coming, and we look forward to many, many more panel discussions with you.
Yes, and a special shout out to NAMI, again, the organization, for letting us utilize their resources to facilitate or help with our discussion.